Stop buying random magnesium just because it's trendy. The wrong pill won't fix your sleep. It will just ruin your stomach. There are over 10 different types of magnesium. Today, I'm giving you the ultimate female mineral roadmap. What fixes your anxiety? What actually cures insomnia? And what to throw in the trash. When a woman runs low on magnesium, her body doesn't just send a quiet warning. It screams at you through severe PMS, painful period cramps, stubborn hormonal weight gain, sugar cravings, and that heavy, unpredictable anxiety that hits you out of nowhere. But please do not just run out and buy the first bottle you see. Let's break down the only 4 forms of magnesium that are actually worth your money and exactly what they do to your body. Let's start with the undisputed holy grail for women's health, magnesium glycinate. If you suffer from racing thoughts at nights, high stress or awful PMS, this is your new best friend. In this form, magnesium is bound to an amino acid called glycine. Glycine is a natural neurotransmitter that tells your brain to pipe down and relax. It crosses into your central nervous system and gently shifts your body from a stressed fight or flight state into deep, peaceful rest. Clinical data shows that taking magnesium glycinate significantly improves your deep sleep architecture without making you feel groggy the next morning. Even better for your hormones, it relaxes the stomach muscle tissue of your uterus. This means it naturally shuts down the painful inflammatory prostaglandins that cause agonizing period cramps. If you want to feel calm and sleep like a baby, this is the bottle you look for. Next up is the ultimate brain booster, magnesium L-Threonate. This is a massive breakthrough in nutritional science. You see, most standard forms of magnesium are completely blocked by a protective shield around your brain called the blood-brain barrier. They can heal your muscles, but they can't touch your neurons. Magnesium L-Threonate is the only form scientifically proven to easily pass through its barrier. Once it gets inside your brain, it increases cellular energy right where your memory and focus live. If you are constantly struggling with the heavy, frustrating hormone-induced brain fog, or if you feel like you can't focus on your work after 2 p.m., this is the exact form for you. It sharpens your mental clarity and acts like a natural shield against cognitive decline. And now, what if your main issue isn't sleep or anxiety, but you just feel physically exhausted and sluggish all day long? That is where magnesium malate comes in. In this version, the mineral is bound to malic acid. Malic acid is a critical component of the Krebs cycle, which is the exact cellular pathway your body uses to turn food into physical energy. Unlike the other forms that makes you feel relaxed and ready for bed, magnesium malate actually recharges your muscle and gives you clean, jitter-free physical stamina. It is highly recommended for women dealing with chronic fatigue, intense workout recovery, or general muscle soreness. It tells your cells to start producing clean energy efficiently. Finally, let's talk about the absolute dark horse of the family, magnesium citrate. This form has a highly specific job. It is an osmotic laxative, meaning it draws water directly into your intestines to get things moving. If you suffer from chronic, uncomfortable constipation, which is incredibly common during the luteal phase of your cycle when the progesterone slows down your digestion, magnesium citrate can be a lifesaver. However, because it draws so much water into the gut, absorption rate for systemic things like sleep and anxiety is quite low. Use it for digestion, but don't rely on it for your hormones. Now that you know the good forms, let's talk about the giant scam sitting on your local pharmacy shelf. If you turn a supplement bottle around and the ingredient label says magnesium oxide, put it back immediately. Magnesium oxide is the cheapest, lowest quality form of magnesium on the planet. Studies show that your body has a pathic absorption rate of only about 4% for this form. The other 96% stays trapped trapped in your digestive tract, causing nothing but sudden diarrhea, gas, and severe bloating, severe gas and severe bloating. Supplement companies use it because it's cheap filler, but it does absolutely nothing to fix your cellular deficiency. Stop wasting your hard-earned money on it. So how do you actually take these forms safely to get the maximum benefit? Let's map out your perfect daily protocol. If you are using magnesium malate for daytime energy and muscle recovery, take it with your breakfast or lunch. Never take malate at night, or you might find yourself full of physical energy right when you want to win out. For magnesium glycinate or magnesium L-Threonate, your golden window is exactly 30 to 60 minutes before you want your head to hit the pillow. Take it with a small glass of water, ideally alongside a tiny snack or right after dinner to completely eliminate any potential stomach sensitivity. When it comes to the exact dosage, human clinical guidelines for women generally recommend a sweet spot of 300 to 400 milligrams of elemental magnesium per day. If you have a sensitive stomach, start small with 200 milligrams for the first week. Let your digestive system adapt and then scale up to your full dose. As a clinician, I always give you the complete safety reality. Magnesium has an incredibly high safety profile because your kidneys are fantastic at filtering out any excess. If you happen to take a little too much, your body will simply give you a mild bout of loose stools to flush it out. However, there are two major exceptions. If you have a chronic kidney disease or any kidney conditions or renal conditions, talk to your doctor first, as your body cannot clear minerals efficiently. Second, if you are taking heavy antibiotics or blood pressure medications, space your magnesium at least 2 to 3 hours away from them, as it can bind to those drugs and stop them from working. For everyone else, it is incredibly safe for long-term daily use. Look, let's be totally honest before we wrap this up. Buying premium supplements will never replace the foundational pillars of your health. If you are sleeping 4 hours a night, surviving on processed fast food, and living in a state of constant unmanaged stress, no amount of magnesium glycinate is going to save your hormones. Think of this mineral as the ultimate turbocharger. When you combine it with a clean diet, consistent hydration, and proper stress management, that is when you will finally see your energy levels go up and skyrocket. Your sleep deepen and your body finally feel normal again. I want to hear from you now. Have you checked the back of your supplement bottle yet? Which form of magnesium are you actually taking, and what changes have you noticed in your body or sleep or mood? Drop your questions and your daily experiences in the comments below, and I will be hanging out there to guide you through it. Make sure to hit that subscribe button, turn on the notification bell so you never miss an episode, and take incredible care of your health. I will see you in the next video. Goodbye.